Good evening, everyone. Let me ask you a question. What would you do if your heart suddenly betrayed you? No warning, no help nearby, no time to think, just you and your body in crisis. Now, if you're over 60, this isn't just a what if, it's a when, because heart disease doesn't knock politely, it kicks the door in. I've spent decades in medicine, and I can tell you something simple but powerful. Knowledge saves lives. You don't need to be a doctor to survive a heart attack. You just need to know what to do in those first critical minutes. Today, we're going to talk about something that could quite literally mean the difference between life and death. How to survive a heart attack alone after 67 life-saving tips every senior must know. This isn't fear-mongering. It sits empowerment. Because once you understand how your body works and how to act when it fails, you take back control. So let's talk science, strategy, and survival. Because your heart deserves a fighting chance. And so do you. When it comes to surviving a heart attack, especially after the age of 60, the first and most crucial step is recognition. The body rarely fails without a warning. It whispers, it signals, it pleads for attention. But too often those warnings are mistaken for something trivial. Indigestion, fatigue, stress, and that's where the danger lies. Because in those few minutes of uncertainty, every second of hesitation allows the heart muscle to die, cell by cell. A heart attack doesn't always begin like you see in the movies, no dramatic clutching of the chest, no sudden collapse. In real life, it's quieter, stealthier, more deceptive. You might feel a dull squeezing pressure in the center of your chest, almost like someone is sitting on it. It may come and go, tricking you into thinking it's just acid reflux, or it could spread a discomfort that moves into your arms, neck, jaw, or back. The pain can feel heavy, tight, or simply off. And then there's shortness of breath. You might find yourself winded after doing something routine, walking across the room, climbing a single flight of stairs, or even while sitting still. Your body is trying to tell you it's starving for oxygen. Sometimes it's accompanied by a cold sweat, nausea, or lightheadedness. You might feel suddenly anxious, sensing that something isn't right, even if you can't explain why. That unease is your body's built-in alarm system. It's evolution's way of telling you, pay attention. Now, I want you to understand something important. The warning signs of a heart attack in seniors often differ from those in younger people. As we age, nerve sensitivity changes, medications can mask pain, and chronic conditions blur the picture. Many older adults, especially women, may experience symptoms that seem unrelated to the heart, like fatigue, dizziness, or discomfort in the upper back. They might not even feel chest pain at all. That's why awareness isn't just helpful, it's life-saving. Think of it like this. Your body is sending you an emergency broadcast, but the signal is faint. You have to tune in to hear it. If you dismiss it, if you say, it's probably just something I ate, or I'll lie down and see if it passes, you risk missing your only window for survival. In medicine, we have a saying, time is muscle. For every minute that passes during a heart attack, about 2 million heart cells die. 2 million. That's why the first 5 minutes after symptoms appear are so critical. The sooner you recognize what's happening, the faster you can act and the better your chance of walking away from it. But recognition isn't just about knowing the symptoms, it's also about knowing yourself. You need to be attuned to your normal baseline. If you're usually active and suddenly feel wiped out after a short walk, that's not normal. If your breathing feels labored without reason, that's not normal. If you feel a strange pressure in your chest that you've never felt before, that's not normal. The older we get, the more we tend to normalize discomfort, chalk it up to aging, arthritis, or fatigue. But pain is information, and ignoring it can be fatal. Now, let's talk about the physiology for a moment. A heart attack occurs when one of the coronary arteries, the vessels that supply blood to the heart, becomes blocked, usually by a clot. That blockage prevents oxygen from reaching part of the heart muscle, and that muscle begins to die. The chest pain, the sweating, the shortness of breath, all those symptoms are your body's way of screaming for help. It's not trying to scare you, it's trying to save you. If you've ever experienced angina or chest discomfort brought on by exertion and relieved by rest, you already have a glimpse of what a heart attack can feel like. But here's the key difference. In a heart attack, the pain or pressure doesn't go away with rest or medication. It persists or worsens. That persistence is your cue that this is not business as usual. And here's another truth. Denial kills more people than disease. Many seniors, particularly men, minimize symptoms because they don't want to make a fuss or bother anyone. They convince themselves it's indigestion or a pulled muscle. But let me be clear, your heart doesn't care about politeness. It needs oxygen, and it needs it now. So what can you do? First, learn the symptoms. Really learn them, write them down, post them where you can see them, and share them with your family or caregivers. If you experience any combination of these: chest discomfort, shortness of breath, sweating, nausea, pain in the jaw or arm, treat it as a heart attack until proven otherwise. Second, trust your intuition. If something feels off, it probably is. You don't need to diagnose yourself. That's what emergency services are for, but you do need to take your symptoms seriously. Call for help immediately. The worst that can happen is that you're told it was a false alarm. The best that can happen is that you save your own life. Finally, remember that early recognition isn't just about observation, it's about education. Teach yourself and your loved ones what to look for. Because when you're alone and seconds matter, your knowledge becomes your best medicine. A heart attack may be sudden, but survival is not luck. It's preparation. Recognizing the early warning signs is your first act of defense, your first opportunity to change the outcome. So the next time your body whispers, listen closely, it might just be trying to save your life. When it comes to heart attacks, hesitation is the enemy. The difference between life and death often lies not in the skill of the doctors or the sophistication of the hospital equipment, but in how quickly you decide to act. The moment you suspect you might be having a heart attack, the clock starts ticking, and your heart begins fighting for its life. Every minute of delay is a minute your heart muscle is deprived of oxygen. Every minute of doubt is a million heart cells dying in silence. I want to be blunt here because sugarcoating this helps no one. If you think you're having a heart attack, you are in a medical emergency. This is not the time to be brave or to wait and see. This is the time to move fast. Your heart is a tireless machine. It beats about 100,000 times a day, pumping life through every vessel in your body. But it's also fragile. It depends on a constant, uninterrupted flow of oxygen-rich blood. When a coronary artery becomes blocked, that flow stops and the heart tissue begins to suffocate. Within 10 minutes, damage begins. Within 30 minutes, that damage can become permanent. And if the blockage persists for an hour or more, parts of the heart can die completely. That's why cardiologists say, time is muscle. It's not a metaphor, it's biology. So what does acting immediately actually look like? It means dropping everything the moment you feel that telltale pain, pressure, or breathlessness. It means calling emergency services, not driving yourself to the hospital. I know many people think, I'll be faster if I just get in the car. But that's not true. If you lose consciousness behind the wheel, you put yourself and others in grave danger. Paramedics are trained not just to drive fast, but to begin treatment on the way. They can administer oxygen, monitor your heart rhythm, and if needed, restart your heart before you even reach the hospital. Every second they save is a second you might live. Yet so many seniors don't call for help. Why? Because of pride, because of fear, because of denial. I've seen it countless times. Patients who waited an hour, sometimes two, hoping the pain would pass, or convincing themselves it was something minor. I didn't want to make a fuss, they'll say. But that hour of hesitation can mean the difference between a mild heart injury and irreversible damage that changes the rest of your life. When you're alone and a heart attack strikes, immediate action can feel impossible. Pain, dizziness, and fear can cloud your judgment. That's why it's vital to plan ahead. Think through what you would do before it ever happens. Keep your phone within reach at all times. Save your local emergency number as a speed dial contact. If you use a smartphone, set up voice commands like call emergency. Make sure your address and medical history are easy to find, written near the phone, taped to the fridge, or stored in a medical ID app. Because when your brain is foggy and your chest feels like it's in a vice, you won't have time to think. You'll only have time to act. Let's talk about the moments between symptom and help, the most dangerous window. Once you call emergency services, sit down immediately. Do not try to stand, walk, or exert yourself. Stay calm, breathe slowly, and loosen any tight clothing. Stress hormones, especially adrenaline, can worsen your condition by raising your heart rate and blood pressure. If you have prescribed nitroglycerin, take it as directed. If you have aspirin available, chew one 325 milligrams tablet or 4 baby aspirins. Don't swallow it whole. Chewing allows it to enter your bloodstream faster, helping to thin your blood and reduce clotting. This small act can make a massive difference in keeping your heart alive until help arrives. And while we're being practical, let me address something uncomfortable. Some people will experience what's called denial of symptoms. It's a psychological defense mechanism where your mind refuses to accept that something serious is happening. You might convince yourself that it's just indigestion or a pulled muscle. You might tell yourself you're overreacting. But listen, this is not the time for self-doubt. The worst that can happen if you're wrong is an unnecessary trip to the ER. The worst that can happen if you're right and do nothing is death. When I was practicing in the hospital, I saw it all too often, patients arriving too late, saying, "I thought it would go away." I also saw the ones who acted immediately. They're the ones who walked out of the hospital days later with their hearts intact. The difference between them wasn't luck or genetics, it was response time. The truth is, once a heart attack begins, no amount of willpower can stop it. Only medical intervention restoring blood flow, usually through medication or a procedure like angioplasty, can save that muscle. The sooner that intervention happens, the smaller the damage. Think of your heart like a house fire. The earlier the firefighters arrive, the more they can save. Wait too long, and there's nothing left to salvage. If you live alone, consider making technology your ally. Medical alert devices, those small pendants or wristbands that call for help when pressed, aren't just for emergencies like falls. Many can detect sudden changes in heart rate or activity and alert responders automatically. Some smartwatches now track irregular rhythms and can even send alerts to emergency contacts. These tools aren't luxuries, they're lifelines. Let's not forget the emotional side of this either. Acting immediately requires courage. It requires trusting your instincts when your mind wants to minimize the danger. It means overcoming that inner voice that says, "Don't be dramatic." But here's the truth. You can't be dramatic when your life is on the line. You have to be decisive. You have to be bold enough to say, "This might be serious and I'm not taking any chances." That's not weakness, that's wisdom. Your heart has spent decades working for you without rest. When it's in trouble, it deserves that same loyalty in return. Acting immediately isn't panic, it's respect. Respect for your body, respect for your years, respect for the life you've built and want to keep living. So the next time you feel that pressure, that strange ache, that sudden shortness of breath, don't rationalize it, don't wait, don't hope it passes. Pick up the phone, call for help, and remember, time is muscle and muscle is life. Every second matters, and those seconds belong to you. When a heart attack strikes, panic is the body's first instinct and your greatest enemy. The fear, the shock, the adrenaline surge It's all part of your natural survival response. But here's the paradox. The very reaction meant to protect you can actually make things worse. When your heart is under attack, every beat is a battle for oxygen. Panic makes that battle harder to win. Let's talk about what's happening inside your body. During a heart attack, one of the arteries that feeds your heart muscle becomes blocked. The heart, desperate for oxygen, struggles to keep pumping. In that moment, your sympathetic nervous system kicks in. It's the fight or flight system. Your body floods with adrenaline, your heart rate spikes, your blood pressure climbs, and your breathing becomes rapid and shallow. Evolutionarily, this response helped our ancestors run from danger, but you can't outrun a heart attack. You have to outthink it. The key is to stay calm. Not because it's easy, but because your heart needs you. To calm is not passive. It's active control over chaos. When you slow your breathing, you reduce oxygen demand. When you relax your muscles, you improve circulation. When you keep your mind steady, you make better decisions. In medicine, we can stabilize your heart with drugs and machines. But before the ambulance arrives, your best tool is your breath. Take a slow, deliberate breath in through your nose for 4 seconds. Hold it briefly, then exhale gently through your mouth for 6. Repeat it again. Feel your shoulders drop. Feel the tension leave your chest. This isn't meditation, it's medicine. Every calm breath tells your brain, we are safe, and your heart responds by slowing down just enough to conserve its strength. If you can, sit down immediately, preferably upright in a chair or on the floor with your back supported. Don't lie flat unless you feel faint, and don't stand or walk around. Sitting upright helps reduce the workload on your heart and allows your lungs to expand fully. This position makes it easier for your blood to carry oxygen where it's needed most. Loosen any tight clothing around your chest, neck, or waist. These small actions create space physically and physiologically for your body to keep fighting. Now, let's be honest. Staying calm while your heart feels like it's being crushed is one of the hardest things you'll ever do, but it's also one of the most powerful. You are not powerless. You may be alone, but you are not helpless. The goal isn't to feel fine. The goal is to keep oxygen flowing long enough for help to arrive. Think of it like keeping a small flame alive in a storm. You protect it, you shield it, you give it just enough air to survive. If you've already called for emergency help, focus entirely on breathing and conserving energy. Don't try to call anyone else. Don't walk to unlock the door if you must. Do so slowly, deliberately, without straining. Each unnecessary movement steals oxygen from your heart muscle. This is not the time to be productive. It's the time to be still. I've seen patients who survived heart attacks alone. And do you know what separated them from those who didn't? They didn't panic. They acted with purpose. They gave their body a fighting chance by keeping calm, breathing deeply, and minimizing strain. One man told me later, I just focused on my breath and kept telling myself, stay alive until the ambulance gets here. That mindset, the decision to stay composed in the face of terror, can literally save your life. Let's talk a little about oxygen itself. Your heart is a muscle that never rests, and it depends on oxygen to generate energy during a blockage. Oxygen supply drops while demand rises. The balance collapses. Every heartbeat under stress consumes what little oxygen remains. When you panic, you accelerate that consumption. Your body starts to hyperventilate. Your blood CO2 levels drop. Your vessels constrict. And the heart's oxygen supply gets even worse. Calm breathing reverses that spiral. It restores oxygen balance, stabilizes your blood chemistry, and keeps your brain alert enough to make the right decisions. You might feel dizzy or lightheaded as the attack progresses. That's a sign your heart isn't pumping efficiently. If that happens, tilt slightly to your left side while sitting. This can help blood return more easily to the heart. Do not strain, Do not cough forcefully unless instructed by medical professionals. The so-called cough CPR is largely a myth for untrained individuals. Instead, prioritize smooth, steady breathing. Let each breath be a deliberate act of defiance against fear. If you happen to have nitroglycerin prescribed by your doctor, take it as directed. It helps widen blood vessels and improve oxygen flow. But do not take anyone else's medication. This isn't the time for experimentation. Chewing an aspirin, if you have one available, also helps by thinning the blood, making it easier for oxygen to reach your struggling heart. These are not complicated medical maneuvers. They're acts of self-preservation you can perform calmly even under pressure. Now, here's something most people don't realize. Panic also clouds judgment. In that haze of fear, people make choices that worsen their odds, getting up to walk it off, searching for painkillers, trying to drive themselves to the hospital. Panic makes you act without thought. Calm allows you to act with intention. You don't need to be fearless, you just need to be deliberate. The goal is not to eliminate fear, it's to keep fear from driving the bus. This is where mental preparation comes in. Before an emergency ever happens, imagine yourself staying calm. Visualize what you'd do if chest pain struck, where you'd sit, how you'd breathe, what words you'd repeat to yourself. Maybe it's as simple as, breathe, help is coming. That kind of mental rehearsal can rewire your instincts, turning chaos into clarity when it matters most. And if you ever find yourself in that moment, alone and afraid, remember this, your calm is not weakness, it's strength in its purest form. It's the strength to think clearly when your body screams for panic. It's the strength to breathe when every instinct says to gasp. It's the strength to trust that help is on the way, that every breath buys you another heartbeat, another chance. So, stay calm, sit still, breathe deeply, protect your heart the way it has protected you your whole life. The storm will pass, but only if you give your heart the oxygen it needs to weather it. Your breath is not just air, it's survival. And in those precious moments, it is the most powerful medicine you possess. In the middle of a heart attack, you don't have time for complex treatments or fancy medical equipment. You have one mission: keep blood flowing and reduce the damage until help arrives. That's it. And sometimes the simplest actions, the ones within your immediate reach, can be the difference between life and death. Two of those actions are using aspirin and getting your body into the right position. Simple tools, simple steps, profound impact. Let's start with aspirin. It's not glamorous. It doesn't look like life-saving medicine. But in the critical minutes after a heart attack begins, aspirin can act like a microscopic hero. Here's how it works. Most heart attacks happen because a fatty deposit, what we call plaque, inside a coronary artery suddenly ruptures. That rupture triggers the formation of a blood clot, which blocks the flow of oxygen-rich blood to your heart muscle. The longer that clot sits there, the more tissue dies. Aspirin's job is to stop that clot from growing larger. It doesn't dissolve it, but it prevents the platelets' tiny blood cells responsible for clotting from sticking together. In other words, it buys you time. But the way you take it matters. If you feel the symptoms of a heart attack, chest pressure, radiating pain, shortness of breath, and you have aspirin within reach, chew one regular tablet, 325 milligrams, or 4 baby aspirins, 81 milligrams each. Don't swallow it whole. Chewing breaks it down faster, allowing it to enter your bloodstream through the tissues in your mouth. Within minutes, it begins to thin your blood, improving the odds that some oxygen can still trickle past the blockage. I've seen patients who survived heart attacks because they knew this simple fact. I've also seen those who didn't because they waited for permission to act. Don't wait, don't second guess. If you're alone and you suspect a heart attack, taking aspirin early is one of the most effective things you can do for yourself. It's not just medication, it's time in pill form. Now let's talk about something just as vital but often overlooked: positioning. How you position your body during a heart attack can change the outcome. When your heart is under stress, every bit of effort you make, standing, walking, even lying flat, forces it to work harder. The key is to reduce that workload and make it easier for blood to circulate. Sit down immediately, preferably upright in a comfortable chair, or if none is available, on the floor with your back supported by a wall. This posture helps your lungs expand, improving oxygen exchange, and keeps your diaphragm from pressing on your heart. It also prevents blood from pooling in your legs, which means more blood returns to your heart and brain where it's desperately needed. Avoid lying completely flat unless you're feeling faint or lightheaded. When you lie down, your heart has to work harder to pump against gravity, and your breathing can become shallower, upright, and still. That's the position that gives your heart the best fighting chance. If you have tight clothing, especially around your chest or waist, loosen it. Anything that constricts your breathing or circulation is your enemy right now. You want your chest to rise and fall freely. You want your blood to move as easily as possible. Every ounce of strain you remove from your body is an ounce of relief for your heart. Now, if you've already called emergency services, stay where you are. Don't pace. Don't try to gather your belongings or make yourself presentable. I've seen people collapse trying to grab their wallet or open the door for paramedics. If you must unlock your door, do it slowly and with deliberate movements, then return to your seated position immediately. Your only priority is to keep blood and oxygen flowing while doing as little as possible to stress your heart. It's also worth noting that aspirin is not for everyone. If you have a serious allergy to it, or if your doctor has told you to avoid it due to bleeding disorders or stomach ulcers, don't take it. But if you can tolerate it and have no contraindications, it's one of the safest and most effective first-line defenses available. Keep it somewhere easy to reach by your bedside, in your kitchen, in your purse or pocket. Make it part of your survival kit, because when the moment comes, you won't have time to look for it. Let me share something I've seen countless times. People underestimate how much these small actions matter. They think, aspirin, sitting up, how can that possibly make a difference? But medicine is often a game of margins. Small decisions that tip the scales in your favor. Aspirin slows the clot. Sitting up helps your lungs. Staying calm keeps your oxygen levels stable. Each one is a small victory that adds up to survival. Here's what's really happening at a microscopic level. As the clot forms, the area of the heart it blocks begins to die. But the body tries to compensate. Tiny collateral vessels, the heart's natural backups, attempt to reroute blood flow. If you stay still and keep your heart rate low, those vessels can sometimes deliver just enough oxygen to sustain your heart muscle until help arrives. But if you panic, move too much, or put your heart under stress, you outpace that delicate system. The damage spreads. That's why positioning isn't about comfort, it's strategy. You're creating the best internal environment for your heart to survive. You're conserving every drop of oxygen, every beat, every moment. Now, let's be realistic. In the chaos of a heart attack, you might not remember every medical detail. But if you can remember just two things, remember these: chew the aspirin and sit upright. Those two actions alone can significantly increase your chances of survival. I often tell my patients, when your heart is fighting for its life, it doesn't need heroics, it needs intelligence. You don't have to be a doctor, you don't need equipment or training, you just need presence of mind and a willingness to act. So prepare yourself. Keep aspirin nearby. Know where you'd sit if you ever felt those symptoms. Tell your loved ones about these steps. Because the most powerful medicine in those first few minutes isn't found in a hospital, it's found in your awareness and your ability to act calmly with what you already have. Your heart has been loyal to you for decades. It has carried you through joy and sorrow, excitement and rest. When it falters, it's asking for help. Give it that help. Chew the aspirin. Sit up. breathe, wait for help. Sometimes survival isn't about doing more, it's about doing the right thing in the right way at the right moment. And those simple acts can make all the difference. Preparation is not paranoia, it's foresight. When it comes to surviving a heart attack, especially after the age of 60, the time to prepare is before it happens. Because once the pain starts, once your chest tightens and your breath shortens, thinking clearly becomes almost impossible. The decisions you make in the calm before the storm often determine what happens during it. Preparation turns panic into purpose. It transforms fear into control. I've spent decades in hospitals, and one thing I've learned is this: people don't plan for emergencies because they don't believe emergencies will happen to them. Heart attacks are something that happen to other people until one day they don't. Then suddenly there's confusion, hesitation, and regret. But here's the truth: with a bit of planning, anyone, any senior, any person living alone can create a simple system that dramatically increases their odds of survival. The first part of your survival plan is knowledge. You must know your risks. Do you have high blood pressure, diabetes, or high cholesterol? Do you smoke? Does heart disease run in your family? These aren't just numbers on a medical chart, they're signals. Each one is a clue about how your heart might behave under stress. Talk to your doctor, ask questions, learn what your symptoms might look like. For some people, a heart attack feels like a crushing weight. For others, it's subtle: fatigue, dizziness, nausea, or pain radiating to the jaw or back. Knowing what your personal red flags are can help you recognize danger faster when seconds count. Next, prepare your physical environment. Keep a plan within reach. Literally, post the steps for what to do during a heart attack on your refrigerator, next to your bed, or by your phone. Include emergency numbers, your address, and your key medical information, diagnoses, allergies, medications, your doctor's name. When panic strikes, memory falters. Written words can guide you when your mind can't. And keep your essentials close. Aspirin, your prescribed medications, and a phone should always be within arm's reach, by your bedside, in your living room, and even in your pocket when you go out. If you use a walker or cane, attach a small pouch to it with your essentials inside. A heart attack doesn't wait until you're comfortable. It can happen while you're getting the mail, cooking, or watching TV. The key is accessibility. If you live alone, technology is your ally. Medical alert systems are not signs of weakness, they're tools of empowerment. A simple pendant, bracelet, or smartwatch that can call emergency services at the press of a button, or even automatically detect a sudden fall or irregular heartbeat, can be the lifeline between collapse and rescue. Modern devices can share your location with paramedics and notify loved ones instantly. In a world where every second counts, these are not luxuries, they're insurance for your independence. Another part of preparation is communication. Don't keep your health status a secret. Let your friends, neighbors, and family know about your condition. Share your emergency plan with them. Make sure at least one person in your building or neighborhood knows how to reach you or has a spare key. I've seen too many tragedies where help arrived just outside a locked door. Your pride should never be the reason someone couldn't save your life. Think of this like building your own personal safety net. You're not inviting fear, you're building confidence. The goal is not to live in anxiety, but to live with readiness. There's a huge difference. Readiness says, if this happens, I know what to do. Anxiety says, what if it happens? Readiness replaces fear with clarity. Let's talk about mindset. Preparing beforehand also means rehearsing mentally. Picture the scenario. What would you do if you felt chest pressure right now? Could you reach your phone? Do you know where your aspirin is? Could you unlock your front door for paramedics without exhausting yourself? Visualize it step by step, not because you expect it, but because practice creates instinct in an emergency. Instinct saves lives when thought fails. You should also prepare your body. This doesn't mean running marathons or lifting weights. It means nurturing your heart long before it reaches crisis mode. Eat foods that protect your arteries, vegetables, fruits, whole grains, lean proteins, limit processed sugars and trans fats. Get regular checkups. Know your blood pressure and cholesterol numbers and keep them in the healthy range. Prevention is preparation too. A strong, well-nourished heart is more resilient under stress. And let's not forget medications. Make sure you know exactly what you're taking and why. Keep an updated list with dosages and timing. If you take nitroglycerin, know where it is and how to use it. Keep a backup supply if possible. Label everything clearly. The last thing you want during a crisis is confusion over which pill does what. Another key piece of preparation is mental readiness. Accepting your vulnerability is not surrender, it's strategy. Many seniors resist thinking about emergencies because they don't want to appear fragile. But strength doesn't come from denial, it comes from preparation. When you accept that a heart attack could happen, you give yourself permission to prepare intelligently. That's not fear, it's wisdom. I remember one of my patients, a retired teacher named Helen. She lived alone, but she was organized, methodical, and pragmatic. She kept her medications on her nightstand, her phone by her bed, and a laminated emergency plan on her refrigerator. One night she woke up with crushing chest pain. Because she had rehearsed the steps, she didn't panic. She took her aspirin, called 911, unlocked her door, and sat upright near the entrance to wait. The paramedics found her calm, breathing steadily. She survived with minimal damage. Her preparation saved her life. Contrast that with another patient who hesitated, searching for his phone, unsure what to do. He collapsed before he could make the call. By the time help arrived, too much muscle had died. The difference wasn't luck, it was readiness. Preparation, at its core, is an act of self-respect. It's saying to yourself, my life is worth planning for. You plan for retirement. You plan for your children's future. Why not plan for your survival? Emergencies don't respect convenience. They arrive when you least expect them, during dinner, while gardening, or in your sleep. But when you've prepared, you turn that chaos into control. So take a moment today, not tomorrow, to get ready. Talk to your doctor, write down your plan. Keep your aspirin close, share your information. Set up that medical alert device. Practice breathing and staying calm. Preparation doesn't guarantee survival, but it dramatically increases your odds. Your heart has worked faithfully for decades without pause. It deserves your loyalty in return. Preparation is how you show it, because when the moment comes, and it might, your best defense won't be luck or chance. It will be the plan you made, the calm you practiced, and the confidence you built long before the emergency arrived. That's how you survive. That's how you live.